The nasal cavity, where it is found, what is its extent and walls, what are turbinates or concha, and what is meatus, and we will talk about its shape. Overall, this cavity, where it is located, it is a very beautiful picture from Gray's Anatomy. If you can see the nasal cavity, it's lying on the top of the oral cavity. In the pink, there is an oral cavity. Above in a purple, the nasal cavity is shown. It is present beneath the cranial cavity. It is present below the cranial cavity. It is present above the oral cavity. It is present behind the exterior of the nose, and it is present in front of the nasopharynx, the part of the pharynx that is connected to the nose. We will discuss it in our next lecture. So this is the location on either side of the nose, on the right side, on the left side, there is this orbital cavity. So nose, it's in a very crucial position. It is related to very important cavities on each aspect. Oral cavity below with hard palate intervening. Orbital cavity on the lateral aspect with the ethmoid bone intervening. Cranial cavity above with the cribriform plate intervening, and posteriorly there is nasopharynx with the posterior nasal apertures between them. So this is basically, we have talked about the walls also. We will talk about what bones exactly form the walls, but you have the general idea which structures are present on against each of the wall now. Oral cavity against the floor, nasopharynx across the base back, cranial cavity in the roof, orbital cavity above, and maxillary sinus below on the lateral aspect, and exterior of the nose anteriorly. To be more specific in defining the extent, we define it by the nasal openings, internal nasal aperture and external nasal aperture right here. So external nasal aperture, also known as the nostrils or nares, posterior nasal aperture, also known as coena. So these are the structures that are defining the limits, and inside the nasal cavity you will see multiple shelves. Nasal cavity is in need of increasing its surface area, so it has multiple shelves that are coming on the medial aspect. So there are three set of shelves. These are known as superior concha, middle concha, and inferior concha. This is the term that is usually used in the anatomy book. The alternate term that I will not be using is turbinates. This is turbinates. This have turbinates. Turbinates is an alternate word for concha. So you may find this terminology in the books also. Overall, the nasal cavity is piriform shape, pear shape. It has a base that is very wide and the apex that is narrow, and it's not simple pyramid. It goes like this. It like a pear. It has a structure. And one thing that I discuss with my students is that they do tend to confuse these two words, concha and coena. When we're talking about the coena, we are talking about the apertures, posterior nasal apertures mostly, coena, and anterior nasal apertures. And when we're talking about concha, we are talking about these shelves. We are talking about these shelves. And the turbinates, as the O cavity is narrow above and wide below. The same is with the turbinates. The turbinates are smaller above, and as we go down, they are large below. The inferior will be the largest one. So the turbinates are basically almost the same distance from the medial septum, because as far as the lateral wall goes, as medially does the turbinate come.